Welcome back. Jubilation over the palace's announcement that Prince William and Duchess Catherine are expecting a little heir to the throne turned to concern for the princess earlier this week when a rare condition, which can leave expectant mothers dehydrated and underweight, landed her in the hospital. She is doing better, but is still undergoing treatment at this time. And our next guest has treated people with acute morning sickness before, and she's Dr. Judine Davis of the Sisters and Charity Hospital of Family Health Center. Did I get that right?
Pretty close.
Pretty close.
Sisters of Charity Hospital. I work at the Family Health Center there.
All right, awesome. And just first off, tell us what acute morning sickness is.
The actual name is hyperemesis gravidarum, and it's acute nausea and vomiting of pregnancy, but this isn't your everyday morning sickness that most people who are pregnant have. This is morning sickness, morning, noon, and night. This is constant vomiting. They are unable to hold anything down. It's waking them up from sleep.
So that sounds pretty severe. I mean, I've seen some tweets out there that people think, you know, she's high maintenance, she has to go to the hospital for morning sickness, you know, but this is serious. People who aren't, you know, don't have that kind of status would also need to go to the hospital for this sort of thing.
Yes, this is an inpatient treatment. I mean, they're losing weight, they're unable to hold anything down, they're having electrolyte imbalances, they're getting very sick.
Okay, and what does this mean kind of for the rest of her pregnancy?
You know, by 20 weeks, this should be well behind her. So by the 4th and 5th month, this really tapers off, and she should be fine.
So they think she's at about 12 weeks right now. She's maybe got a little bit of a road ahead of her then.
A little bit.
All right. And so how does somebody know if, you know, their morning sickness has gotten to that point where they need to go to the hospital and really get some help?
They're going to feel very sick. They've been unable to hold anything down for a day or two. They're losing weight. They're feeling weak.
So how much weight loss are we talking about? Because some people may lose a little bit of weight due to morning sickness, correct?
Yeah. We're talking about 5% of your body weight. Kate's pretty slim, so 5% of her body weight, I think, would have been significant for her.
Okay, and you said you have seen it enough in the hospital. I mean, it's common here in Buffalo as well. Tell me a little bit about that.
Patients will come in. They will usually come into the emergency room. We'll try to give them some IV fluids, see if they can then hold something down. But someone who really has this abnormality, even if you give them some IV fluids, is not going to be able to hold food down. They're going to get admitted to the hospital, and over the next couple of days, slowly increase their diet until they're able to hold things down without IV fluids.
All right.
So it's a couple days.
And if people need more information, where can they find it?
Oh, certainly they can go online and look up hyperemesis gravidarum.
If they can spell it.
If they can spell it, right.
And they can always call the hospital, though, if they have questions, too, correct?
They can call the Family Health Center anytime.
All right, great. Thank you so much for being with us today.
Thank you for having me.
Send things on over to Emily Lenahan with your .com check. Hey, Emily.